If you had weight loss surgery a while ago and you're thinking you might need a revision, stay with me for a minute. I'm a registered dietitian with over 20 years in the bariatric surgery world, and I might have some words of wisdom for you. First thing is, keep in mind that a revision to a weight loss surgery is the last thing most surgeons want to do. So if it can be avoided, we should try to make sure we exhaust all other options before that is done. Most doctors will first want to see what's going on with your surgery. So they'll do an endoscopy and take some pictures of your stomach area just to see if there's anything seriously wrong that they would have to revise. In those cases, then a revision is definitely warranted. Let's say everything looks good, you're just gaining weight back, you're hungrier, you feel like you're eating more, and you want some help with a revision to help take that hunger away and help you get back to weight loss. This is where we have to exhaust all our other possibilities. The first thing is to keep in mind that after a couple years from having the surgery, you're going to be able to eat a little bit more. You're probably going to lose that excitement, that fire in your eyes for having weight loss. So therefore you might give in a little bit more to some cravings, things you didn't do the first year or two. That's normal. But what we have to also remember is the most common reason a person gains weight back long-term after weight loss surgery is they start grazing or snacking more often than they did in the beginning. What I want you to do is identify your eating habits a little bit closer. Take stock in how many times you're eating per day, and when I say times, I mean anytime you put food in your mouth and chew it, you count that as an eating time. Then get a good idea for your caloric intake. Is it twice as much as it used to be, or you have no idea? If you have no idea how many calories you're eating a day, we're not even going to talk about a revision yet because we have to see if we can make those changes first. If you think you're eating low calorie, if you're only eating 3 times a day, all the boxes are checked and you're still gaining weight, and that's when we start talking seriously about a revision. Another option you can take if you haven't already is go the route of semaglutide, Ozempic, because studies are showing that post weight loss surgery patients do well with some sort of weight loss medication help. So if you haven't done that before a revision, you may want to look into that as well. Working with an expert in your field, a doctor or a dietitian like myself, can also help get you back on track, figure out the little nuances as to why you're not losing weight. That's what we do for a living. So you might want to look into that. Again, we want to try to push the revision idea out for a while until we can exhaust every other reason why. So keep these in mind if you're really just thinking, I just need a revision. It's the last thing we want to try to do until we make sure you really, really need it.